Warm greetings, everyone. Let's talk about post donation care. Once a donor completes his or her donation, they are asked to apply firm pressure on the needle insertion site for at least 5 minutes after the needle is removed. They are also advised to keep the bandage on for the next 4 to 6 hours and avoid lifting heavy weights or strenuous activity for the next 48 hours after donation to prevent bruising and dizziness. In case bleeding or bruising develops after they've left the blood bank, they are advised to apply firm pressure on the needle insertion site and lift their arm above the shoulder for 5 to 10 minutes. Once the bleeding stops, an ice pack wrapped in a moist cloth should be applied on the affected area for up to 20 minutes, 3 times a day for the next 24 to 48 hours. In case they develop severe pain, persistent numbness, or large swelling that is increasing in size or painful to touch in the donation arm, they are asked to call back for advice or consult a nearby doctor. Drinking plenty of fluids over the next 48 hours is advised, as well as consuming iron-rich foods in general. They explain that a small minority of donors may feel lightheaded or weak, or experience anxiety, giddiness, or nausea after blood donation, and this may be reduced by resting at least 20 minutes at the blood bank, not smoking for at least an hour after donation, and avoiding alcoholic drinks for the rest of the day. In case they feel dizzy, unwell, or have cold sweats, they are advised to take a seat or lie down immediately, preferably with their feet raised, until the feeling passes. Loosen any restrictive garments, keeping calm and breathing smoothly, taking slow and long deep breaths, and seeking assistance from people near them. If the condition does not improve, or for any reason something does not feel right, they are asked to call the blood bank. When the donor feels well enough, they are directed to the donor refreshment room where refreshments and a sheet containing post-donation information are provided. They are advised to call back if at any time they believe that the blood donated might not be suitable for transfusion to a patient, or develop an acute infection within 4 weeks of donation, or develop jaundice, hepatitis, tuberculosis, or malaria within 3 months of blood donation. After the donor has taken the refreshments and completed about 20 minutes of rest, they are allowed to leave provided they feel well enough and are asked to avoid self-driving for the next 2 hours. Thank you and have a nice day.